Good morning, and thank you for joining us here on the Morning Medical Update. I'm Jessica Lovell. It is summer, and just like many of you, we are working hard to bring you some fun and exciting shows come fall. This morning, we are bringing you a rebroadcast of one of our favorite shows. If you have any questions, please leave them below. We will answer them during our live broadcasts on Monday, Wednesdays, and Fridays. So sit back and enjoy this Best of Morning Medical Update. Good morning, everyone. It is Thursday, January 27th. Welcome into the Morning Medical Update. Thanks for joining us on Facebook and on YouTube. Today, we take you inside a place few people ever get to see, the Decedent Affairs Department, also known as the morgue here at the health system. With the massive influx of COVID deaths, we feel it is important to make people understand how real this is. People are dying daily, and most of these deaths are preventable. Plus, Amanda Cackler, Director of Infection Prevention and Control, she is back to help us better understand how we classify COVID deaths that make up our daily COVID count. Also, if you're just waking up with us today, Park Hill students will have the next 2 days off due to an increase in COVID cases among teachers and students. The school board will meet tonight to discuss extending mask requirements. Also, only around 38% of Missourians have had a third dose of the COVID vaccine. 55% have had 2 doses and 64% just 1 dose. Dr. John Doolittle, he is the president and CEO of the Missouri Hospital Association. He is pleading with the unvaccinated to get their shots. So if you have questions, get those sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. And with that, Dr. Dana Hawkinson joins us with our morning COVID count. Good morning to you.
Hi.
Hi.
122 active patients today, 27 in the ICU, 15 on the ventilator, 97 in that recovery period, so a total of 219. Good. Still a large proportion in the ICU that remain on the ventilator. Really hoping those hospitalized numbers go down. I'll be certainly happy when we start to see them trend down under 100. I think that will be the best indication that there is a real significant decrease in the prevalence of the spread of the disease in the community. But still right now quite high.
All right, thank you for the update this morning. We'll get back to you in just a moment. Before we start our conversation, do we have any reporter questions on the line today? Okay, we do not. So we're going to get to our community questions here in just a few moments, and we're also going to get to our guests. But before we do that, we want to set up our conversation with a video that we're going to show you. But we do want to warn you that this video will show deceased patients bagged and in our refrigeration rooms. We know that this is simply not for everyone to see, and we just wanted to give you that disclaimer before we take you inside our morgue. Dr. Ciara Wright walked me through a typical day inside the morgue where she works, comforting families, handling patients, and like most departments, managing the minute to minute. So you have 3 here and 6 over here. Is this typical or is this COVID?
This is COVID. This is definitely COVID era. This is Ciara. How can I help you?
Dr. Ciara Wright is Decedent Affairs Coordinator here at the University of Kansas Health System.
Oh, this patient just came.
It's what many of us would refer to as the morgue. So sometimes they're lined up here.
Oh yeah, definitely. They'll be lined up here. We'll get tables from upstairs and we'll just use what we got.
You're making it work the same way everybody else up on the units are trying to make it work.
Absolutely. This is where we keep our patients. This is our 3 decedent refrigerator.
And I see COVID written on one of the bags. Tell us why that is.
This is to make whoever is going to handle the patient after the patient leaves Decedent Affairs, so they are aware that the patient is COVID positive.
And he's got his wedding ring and his watch and his hearing aids. We should just keep those with him, I think.
Lives cut short.
They expected to have so much life to live, but yet they're down here in the morgue. We have to take this serious. We have to know that life is very short. It's sad, and COVID is serious.
Dr. Wright admits it can be overwhelming at times. She never loses sight of what's important, the patient, and now their family.
And a lot of times they call down here and I just let people vent. They talk about their situations and what's going on, and I'll sit on the phone and listen to them till the cows come home. But you know, we just want to be there for our family.
It takes a certain kind of person to do this work. Dr. Wright is that person. What kind of concerns do you have down here in your department?
Our concerns are the funeral homes going to come fast enough? We do have access to a refrigerated truck. We don't want to use it if we don't have to.
For people who don't think that this is real, so what do you want them to know?
This is real. Like, this is really real. This is not a made-up disease. This is not something that is going to go away next week or next month. Like, we have to take this serious.
And again, we want to welcome back in Dr. Dennis, Amanda. Hello, and Dr. Wright. How are y'all doing today?
Good morning.
All right. Well, I want to start with you, Dr. Wright. First of all, just thank you for taking me along, kind of inside what's going on in your daily life. And what I really learned and what struck me and when I walked out was that you really care for these patients. They're patients even in death. And it takes a certain type of person to do this. What kind of qualities do you have to do to be able to care for these patients?
Be empathetic. We want someone that cares about people. We want you to feel like everybody that comes to the morgue is your relative and treat them as such.
Talk about some of those experiences and what it's been like handling the patients after death, but then also handling the families and connecting with them, because you have quite a connection with your families, don't you?
I definitely do. I was in the situation that they're in. My brother passed away here at the hospital, and I know how it is to have somebody you lose that you wasn't expecting to lose. And so to have someone that is going to talk to you and just listen to you, that means more than anything.
So how has COVID impacted how you're able to do that? You have more deceased bodies coming in, and you're wanting to do your job and be there for families. How has it impacted the job you're doing?
Our team, we've come so much closer together. We work harder. We just try and build our relationships with our outside companies, our funeral homes, our crematories, just so everybody knows we're in this together, but just to make everything run in a full circle.
So when you come in every morning, what starts your day? Tell us a little bit about how that goes.
So when I come in the morning, I have patients that have passed away overnight. So I count all of my patients. I make sure everything matches. I call Midwest Transplant Network, and I make sure that they're not a donor, or if they are a donor, we get them sent to MTN. If they're going to be a saving site donor, we make sure we connect with them, just get everybody to the right place. And then from there, we call the funeral homes. We make sure they're not in for an autopsy. We just kind of dot our I's and cross our T's.
Dr. Dennis, good morning to you. Thank you for joining us. Dr. Dennis is a pathologist here. She does the autopsies here at our health system. This is a place that a lot of people don't get to see. Dr. Dennis, tell us just in general what you want people to know about the job your team does.
Yeah, so as physicians, our training, really focuses on taking care of patients and treating patients and saving lives. And so dealing with the other end of that spectrum is difficult. What happens when patients don't get better and what happens when patients die can be challenging to deal with, but that's what my team is trained to do. So I would want people to know when patients die in our health system, they're taken care of by a team of professionals who find this work very important. And we hope that we're helpful to the families as we work through this process with them.
Compare your department before the pandemic to now.
Sure, yeah. Especially right now in this month of January, we're seeing the most deaths in 1 month, I think, that we've seen in the whole pandemic. So that's challenging to deal with a surge in deaths, like Ciara was talking about. On top of, taking care of the patients who die of other causes, and on top of making sure we stay up to date on guidelines on workplace safety and making sure the people who work in our department are safe. So it can be really challenging to deal with that all at once, and so we're experiencing similar challenges in our department that we're seeing across the health system.
With the increased amount of deceased patients, how likely would it be that we would have to bring in a refrigeration truck? I think that's something we saw in images across the country at the very beginning of this pandemic, and we hoped that we would be shielded from that and that we wouldn't be in that position. How likely would that be?
Yeah, we keep a close eye on our capacity and how we're doing, and in this month of January we're at or above our morgue capacity almost every day, which is definitely unusual. So, it's not something we want to do, but it's something that's necessary to be prepared for just in case, and that would be our plan. That's our backup plan, to have those refrigeration trucks available if we run out of space. We haven't had to use them yet, and we hope we don't, but we have to have that ready to go. So that's something we're looking at more closely this month for sure.
All right, Amanda Cackler, with that, we've
Yeah.
had nearly 50 deaths so far this month. Just kind of get us up to speed. What do we need to know?
Sure, and I think it's important whenever we're talking about COVID deaths, I have to report them out in a variety of ways. So it's really important whenever anyone asks a question about a COVID death, what exactly are they asking about? So for instance, the state of Kansas, which is the health department that we work with, we have to report any patient that we know has died and also had a COVID positive test in our system. So those patients may not have even come to the hospital, but we're responsible for reporting that death to the state. So that is a different number than what we typically report out each morning, which are the patients that died in the hospital, and they also were active with COVID while they were here at some point. So the number that you speak about is the number that we have treated for COVID in the hospital, and they also died. But what it doesn't mean is that they died because of COVID, and I think that's something that we get questions about quite often. How many are dying from COVID and how many are dying with COVID, which do mean different things.
And I think that is confusing for the public, and we want to be as straightforward as possible and not just give them numbers. We want to give them numbers and context and what that means.
Right.
And you said, 2 years ago, you didn't expect to be doing this 2 years later. And so explain to people how difficult it is to navigate when we're talking numbers and the volume of people.
Yeah, and I think, we've seen, and I think Dr. Williamson talked about this last Friday when he was here, the capacity of the morgue really hasn't changed despite an increasing volume of inpatients that we've taken care of. In the midst of the pandemic, we also opened up capacity of about 100 additional inpatient beds. And so as we're taking care of sicker patients just in the community, and then also confounded or compounded with COVID, we're going to see more deaths. So I looked at, because this question came up last week, how many deaths do we typically see on any given month? And in the 2 years leading up to the pandemic, we would see anywhere from 50 to 90 deaths. So that's a lot of deaths. That's a lot of deaths that you're dealing with in your everyday. Since the pandemic has started, we've seen anywhere leading up to 130, 150 deaths each month. But again, it's not all COVID. There's definitely a lot of COVID in there. But again, we added 100 additional inpatient beds, predominantly targeting our cancer population. But we've seen a lot of just very sick medical patients coming in here for the various reasons that we've already talked about before when we were we just know that there are a lot of sick patients out in the community, and some waited a little while before they came in. But in the beginning, it was easy because we would see just a handful of patients who were dying. And then as the months have gone on, it's harder to separate, are they here for COVID? Did they die of COVID? Is it
And
a
how far
complication
out,
of
how bad, you have to start backing it up when they had COVID.
That's right.
And what type of effects, what kind of long haul symptoms they've had that may have
right.
led to a death.
Which my team does not do that.
Right.
We know they had a positive COVID test. We know that they died, and then we let our physician colleagues determine, what was the cause of death, and that's something that the state of or the Kansas Health Department also minds out whenever they're doing their reporting. They have a physician who's evaluating that patient and clinically what caused them to die.
But yeah, there's more to it as we get farther and farther along in this pandemic.
And it is extremely complicated.
And that's why we have you doing that and explaining those numbers. So thank you for that. Dr. Dennis, I wanted to ask you about a couple of things pertaining to your job. We don't do autopsies on COVID positive patients. That seems to make sense, but can you explain that for us?
Sure. When COVID first, came out, the CDC issued guidelines for institution performing autopsies, and this was in the era before there were vaccines, before we knew much about the virus and how infectious it might be, and before there were therapeutics. So in their guidelines, they list out the recommendations for the ventilation system in morgues to do these cases. And so here at our institution, we don't have those strict ventilation rooms. So we don't do autopsies on acutely positive patients because of the risk of infection, even though it's low to our workers. We have done autopsies on patients who die of COVID but are kind of past the infectious period. And it is important to point out that since the beginning of the pandemic, before vaccines or anything, pathologists all around the world and all around our own country were doing autopsies on COVID patients. And the role of autopsy in emerging diseases is critical in public health, and that's how we find out, what kind of tissues and organs that the virus is infecting, how it's damaging the body, so that we can align our treatments with that. That's how we found out COVID causes clotting issues in patients, which wasn't expected in a respiratory virus. And so autopsies have been critical to ultimately treating patients who are living with the disease.
Thank you for sharing that. That's something I don't think we think about, is that these patients are helping us learn more and more about COVID to help treat other people. Dr. Wright, I want to ask you about something. In the story that you and I did last week, we talked about people believing this is a hoax, or not thinking COVID is something they need to take serious. And that's really why we wanted to share this story today. But your husband was one of those people until you got COVID.
Yes.
Tell us about that.
First, he's going to be upset with me for saying that.
Okay.
But when I got COVID in January of last year, my lung collapsed. He didn't think that this was a real disease. He didn't think it was real. And
But he's not the only one, though.
No,
so
he's
that's
not.
okay.
Definitely not.
That's
so
okay.
don't get upset with me. So yes, but he took it serious, a lot more serious now than he did, and then he got sick. So now it's real.
But I mean, I'm glad you shared that, because again, not alone. That's people. It takes time, right, Amanda? We've seen these stories. We've heard these stories where people didn't think it was real. It's hard to get on board when this pandemic comes out of nowhere. People are dying. It's hard to understand, and you're living it every day.
Right.
Yeah,
That's
absolutely.
yeah.
It has been one of the difficulties of this pandemic is making sure that people understand that this isn't a hoax and that it is impacting real lives every single day. But it's the reality is that this wasn't something that we were talking about 2-3 years ago. Well, I guess 3 years ago we weren't talking about this, and so it is something that people have had to adjust to, the new reality.
Share some stories. We mentioned you've mentioned a couple to me about families that are having a really difficult time, and you're really there. I always think of funeral directors and the funeral home process is where they're helping to help families through the mourning process. But it actually starts with you in many ways. Tell people something I didn't know also is that we have a viewing room down in our morgue.
Yes, we do.
Tell me about that.
So our viewing room is set up for our families to come down and view the patients, as long as they're not a coroner's case. We can set it up. We can have snacks down there for the families, and they can just sit with their loved one and be there for a few hours until it's time for the patient to go to the funeral home. And a lot of these patients that come down to our viewing room, they are going to a crematory. So this is the last time the family can actually lay eyes on their loved one, and we love that we're able to offer that. But right now, due to COVID, we're not able to open that up to any of the families. But a lot of these families are calling us, and they're just kind of venting to us about how they thought this wasn't real, so nobody got vaccinated. And now that their loved one has passed away of COVID, now they do want to get vaccinated, but it's too late. They wish they would have had this serious conversation sooner.
There's not a lot you won't do. You said you try to answer the request. You've even taken the phone over to to a decedent.
Absolutely. So I've had a family member I've performed an autopsy on, and after I got done, I called the loved one and I put the phone close to the bag and just put it on speakerphone and just let them talk. And to us it seems small, but to the family members it's not small. This is huge. This is their last point of contact with their person.
Doesn't seem small to me.
No, it's not small.
That's a big deal.
It is.
Thank you for the work you're doing. I had some more questions for our guests, but so does our community. So I want to get to our community questions because they're asking some good ones. And the first one is from Lindsay. Well, I'm going to ask you, Dr. Hawkinson. Lindsay wants to know, if a new booster is on the way to protect Omicron, why get boosted now?
Yeah, I mean, there's still a lot of questions about this and understanding. I think that's a very valid question from the viewer. Certainly the recommendation from the CDC is still to get a booster even after you have been infected. But I think we are going to see evolving data on this. So right now, again, the recommendation is still to get that dose if you haven't been up to date with that booster dose, even if you've been infected. But I think there are other experts, there are other opinions out there that if you've been vaccinated and had the infection, you may not need that. But we are really trying to continue and be consistent with what we've been doing throughout the pandemic. And right now, the CDC recommendation is still to get that booster. But certainly, once they change their recommendations, we'll inform you. But again, there are other expert opinions that would have that same thought as well, that you don't necessarily need it. I think for safety, because we know the vaccines are safe, I think it is still probably a good idea. Again, it's still a recommendation of the CDC, so we're going to stick with that for right now.
And I think just something to add to that, I was looking at the MMWR that you mentioned, I think on Monday, the impact that we now know about the boosters and the reduction of them coming to the hospital if you have COVID. I think it's extremely compelling, and I know community members ask all of the time, what can they do for us here in the hospital? Well, what could be better than keeping you out of the hospital if you don't need to come here, especially with COVID? I think what you can do is you can get your booster if you're due for it.
Very few instances where someone wouldn't be able to get a booster, correct?
There should not be a reason you can't get a booster.
Yeah,
they are
exactly.
on the shelves. They are ready for
to
arms.
go in
Yeah.
arms. Okay. Pamela wants to know, are COVID patients and long-haul patients that pass away still able to donate their organs? I know you handle organ donation with the decedents. Tell us what you know about that.
From what I know, if you are COVID positive, you cannot be a donor.
Dr. Dennis, what can you share?
Yeah, that's what we've heard from our partners at Midwest Transplant. Acutely positive COVID patients, they usually don't accept them for donation to living patients. They do have other programs where they have tissue donations for research or other programs. So that's something that families could talk to the transplant programs about.
Dr. Hawkinson, did you have something to add?
Yeah, I actually talked with Sean Coomer about this week, and Dr. Coomer was on the show. There are some transplant areas around the nation that have been accepting. I think we have done some acute positive or recovered, more of that recovered period of the of kidneys, no livers, no hearts from what I understand at this point, but there are some centers around the United States. And I think it really depends on what stage, how far out are they from their actual, from their infection. So I think when we're asking about this, it's really important to understand, are you coming in within the first week or 10 days, or is it spread out further than that? But there are some places that in some cases are accepting some recent acute infections that maybe have recovered. So,
Dr. Dennis, Jay is curious, who decides if a deceased patient gets an autopsy?
Yeah, here in our health system, we offer autopsies. Families can request one, or physicians for patients that die of natural causes, and those are free to our families. In the COVID era, we have guidelines in place that if you've been tested positive in the last 30 days, that we don't offer autopsy on those patients. But if it's been longer than that, then we work with the families, and we can approve those autopsies to be done.
And something I learned just visiting with you this morning is that any family can ask for an autopsy for any reason, correct?
Yep, that's correct. As long as they die of natural causes in our hospital, then families can request autopsies, and physicians can too, and the families have to give permission for that.
Joanne, I hope that answered your question, that we do not do autopsies on COVID-positive patients. A question from Carol. She's prearranged to donate her body to science. Are cadavers still needed? What do we know about that?
Yes. So
Yes.
I work with the Will Body program a lot.
Yeah, tell us about that program. Very interesting.
So the Will Body program is an awesome program. If you want to donate your body to science, you can. You would just have to go through a process. They do kind of do a process of elimination and look for certain things, to certain criteria. But if you do qualify, then the University of Kansas, the school will come over and pick the patient up, and they'll go from there. They keep the patient for 1 year, and then they cremate the patient and send the remains to the family.
All right. Question from Virginia. How long after having COVID can you get your booster? Can you just go get it? Or
Yeah.
you still have to do the waiting period?
yeah, so I think it goes back to that first question of, if you've had COVID, some people would recommend that you don't need it. The CDC does still recommend that you should get it. And right now the CDC does also consider that if you have been recently infected, you are essentially protected, or you're considered recovered and protected for about 90 days. So again, the CDC recommendation is still to get that booster, but because they do say that for other purposes, there is 90 days after that infection, I would say probably waiting 60 or 90 days before getting that booster. And that booster may also help to further expand that immune response. So no specific concrete guidelines other than the recommendation is still to get that additional dose even if you've had COVID-19. But if you've had COVID-19, you are considered protected for 90 days. So with those two things being said, I would say if you wanted to wait 60 to 90 days, I think that's reasonable, especially now because we know 99% or more of the variants or of the viruses around the United States is Omicron, so you're going to have some protection from that.
Amanda, Craig wants to know how many of those near 50 deaths were vaccinated? Do we know that number?
I don't know the number right off the top of my head, and I think something that we talked about a little bit the last time I was here, I guess was Friday. What does vaccinated mean? Is he asking how many have received their primary series? Is he asking how many have received their primary series and have also been boosted? That information I could probably get pulled together and perhaps share it at a future show.
Because that was another question, is how many people are hospitalized after the booster?
Yeah, so I ran this yesterday, and Dana, you're gonna have to keep me honest because I can't remember the exact number, but I know it was like 12 or 13 of the 112 active or 115 active were both vaccinated and up to date with their booster. So it's a very, very
like 11,
small
11%.
population of our active inpatients are what the CDC would call up to date, vaccinated and boosted.
And those numbers check out because when you're
They do.
vaccinated, you're out of the hospital.
And I would venture with that population, because we know a lot of people are not getting that boost or are overdue. We've seen that. So they, I would suspect, have those other comorbidities such as age, diabetes, obesity, heart disease, lung disease, kidney disease. So, but
And that has been, whenever we've looked
That's been
into that, it's
pretty
been pretty
consistent.
consistent throughout the pandemic that the
Or
folks who are
cancer,
here,
chemo,
who
yeah.
are also vaccinated and here with COVID are incredibly ill with underlying conditions like cancer, organ transplant, significant cardiac disease, those sorts of things.
But it tends to be a lower percentage that are fully vaccinated up to date that are actually in the ICU or on the ventilator. And that's been fairly consistent as well.
Very true.
Dr. Wright, Anil is asking, are deceased COVID patients still contagious? Do they have extra precautions that they take handling them? We saw that in the video that we showed before the conversation. Tell folks how you do handle the COVID patients.
So the nurses on the floor do double bag the patients. We write COVID positive on the bag, and that's pretty much what we do.
So they're double bagged up on the ICU floors and then transported down. And you write COVID on there so that anybody handling, so when you're sending them off to the funeral homes, they're aware of that.
Yes.
How do you, we were talking a little bit, how do you stay positive and up? Just in visiting with you, you always have such a really, you're so happy, and I know you're so happy with the work that you do, and it does take a special kind of person, but how do you go home at night and relax and kind of focus and recenter?
I think I love the fact that I have this opportunity to be there for our patients. So that kind of brightens my day to know that, I was that point of contact to help them. But when I go home, I just love on my 5 children. They just got me a new dog, and I got a golden doodle and a poodle. So
life is good.
Them, yeah.
Life is good for you.
And I just want to say, it takes a special person to do what you do. I know it's been a long time since I've been like truly a nurse at the bedside, but I know post-mortem care was something that it was challenging. It was hard to do. It's not something that you spend a lot of time learning about or get that hands-on opportunity. I mean, you could be a nurse for a very long time and never have to visit the morgue. And for you to work day in and day out and do what you do and be able to influence and take such great care of the patient and their family, thank you for doing such an amazing thing.
We are more than happy to do it. And it's not just me. My team, Waylon and Ashley downstairs, we are a team, definitely.
Well, and I said this last week when you and Dr. Williamson were on and we were talking about my trip down to the morgue. I said I think we imagine it to be something that, you're right, most of us see it depicted in movies and TV shows, and it was very different. I walked down and it was very peaceful, and it felt welcoming, and I felt again like these were patients. I didn't know what to feel going down. It's something, again, not very many people get a chance to do, and to go down there and I really felt like I was surrounded by patients that you were caring for, just like when we go up and show video up on the ICU floors in any place in this hospital. So I echo Amanda. Thank you for doing that work. Deb has a question, Dr. Hawkinson. How much protection do you have if you are 4 to 5 months out after your booster? Do we know?
Yeah, I mean, I think we have to define protection here. Are we talking about protection from infection? You know, we know that protection from infection does decrease, especially with Omicron because of the different spike and its ability to evade our current antibodies, or the majority of our neutralizing antibodies. But for protection from infection, it's probably fairly low. And that's why we always continue to say be thoughtful and mindful of those situations that you're in, understand about masking, distancing, those things. If you are talking about protection from hospitalization, severe disease, and death, you still have very good protection from hospitalization, severe disease, and death, ranging probably about 80% or more. And then, of course, some of that will depend on your comorbidities as well. But if you do have that boost, you should take some comfort in understanding that protection from hospitalization, you continue to have very good protection from that.
Question about testing, Dr. Hawkinson. Andy is asking, what is the best way to test for Omicron at home? I'm seeing more and more people say that at-home tests are not picking up positives where PCR tests would be doing that.
Yeah, I think that's a good thing. There's also things to consider, but we know that a study out of San Francisco, UCSF, looked at the Binax-2 test, which I think is from Abbott. It's one of the more prevalent tests that are available when at-home tests are available. That continues to have a 95% specificity, meaning that if you have the disease, you have a 95% chance of picking it up and being consistent with that PCR test. The other things to consider with the at-home test is the operator. So who is performing the test? Are you getting an adequate sample? Are you sticking it in your nares or your nasal passages far enough to get an adequate sample? But in general, that is the best evidence that I know of. I'm not sure about any of the other tests or if independent studies have been done with the other at-home tests, but we know that the Abbott Binax-2 test does have about a 95%, so it's a very high percentage. And if you are continuing to have symptoms or you know you've been exposed and it is negative, then they do recommend testing 24 to 48 hours later to see if you're positive. But overall, I think it's about 95%. Just make sure you're getting a good sample.
All right, Pat also wants to know, is there a new Omicron variant and has it showed up in Kansas City? What do we know about that?
You know, I think we're going to see news reports about other variants all the time. You know, we know that Alpha was displaced by Delta. We know that Delta was displaced by Omicron. I'm not aware of any clinically significant or prevalent variant right now. We know that there was a news report about Deltacron, which they thought was a combination of Delta and Omicron variants. However, that was a lab mistake. That was contamination. That actually turned out not to be true. I think we are all expecting further variants to come out at some point in time and eventually displace Omicron. That's just because all of these susceptible people now have been infected with Omicron. And so as new variants come about, we will see what happens, but I'm not aware of any prevalent or clinically significant variant around the world, and especially not in the Kansas City area right now.
All right, we're going to get to final thoughts here in just a moment. We're getting a lot of questions about kids and vaccines, and we are going to be joined by Children's Mercy tomorrow, so I'm going to hang on to those questions if you don't mind. Stick around for that, but let's get to our final thoughts. Dr. Dennis, I'm going to start with you. Thanks for being with us today. Just your final thoughts on what you want us to know about the job you're doing.
Yeah, I would just want people to know that there's information out there that this variant is maybe more mild than other variants in the past, but we have to remember that's a relative term. And because this variant is so much more infectious and transmissible, the sheer numbers of patients that are infected is going to translate to higher total numbers of patients who will need hospital care, and then perhaps higher numbers of total patients dying. And so that's what my team is prepared for. So I would encourage everyone to get vaccinated and boosted.
Thank you for that. Dr. Wright, thank you so much for being with us. Thank you for all of the work that you're doing with our deceased patients. We appreciate you. Final thoughts. What do you want folks to know? What message do you want to send out?
I just want to let people know to take this serious and to be kind and be nice to each other. We're all dealing with something, and we just need that extra love for each other.
Extra love. Amanda.
Yeah, we are. I'm usually on the weekend, so I have my weekend wrap up. We have some exciting sports things happening this weekend with the Kansas-Kentucky game, Bengals and Chiefs, and the likelihood of folks hanging around other people that aren't typically in their household is likely going to be very high. I know we've got some power and light parties planned, and I think it's just please don't let your guard down right now. If you're going to be in a public space, definitely have masks available, wear them correctly. If you can socially distance, do so to the best of your ability. What we can't afford right now is another increase in patients that need to come into the hospital. We just don't have a lot of room for them. So be safe and definitely show your team spirit, but do your very best to be safe.
Is that something you guys get concerned about and talk about when we have these big events like this?
What will we do if, even if we have another 20 patients, which doesn't sound like that many, but that's a lot of patients to find beds for if they should have to come to the hospital.
And patients we wouldn't normally have
Yeah.
here. All right, thank you for getting us updated on numbers today. Dr. Hawkinson, final thoughts for us.
Yeah, I would just like to thank our guests and, such sobering and real news and real information from the people that are doing it on this front line. And unfortunately, it continues to be a front line, continuing to treat those people that have passed so tragically from a essentially preventable disease, still showing respect for those patients. I think it is important to know and understand, and they have probably seen too many of that right now. So I think it continues to be important that we give that message about getting vaccinated. If you're vaccinated, be up to date with your booster. Great question earlier. You are still going to have very good protection from hospitalization, severe disease, and death if you remain up to date with that booster. So with that knowledge, I think it's always a good time to go out and get the vaccination if you haven't received it yet.
Thanks so much, and thank you all for being with us today. Don't forget, you can catch our shows anytime by logging back on to Facebook and our YouTube channel. Coming up tomorrow, thousands of children have come down with COVID, and many, of course, are spending time at Children's Mercy. Children's Mercy will join us. Multi-inflammatory syndrome is showing up more and more in children, so we're going to talk more about what it is and all things kids tomorrow on vaccines. So join us tomorrow at 8. Have a great Thursday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.
Thank you so much for joining us this morning for this Best of Morning Medical Update. You can catch our live broadcasts every Monday, Wednesday, and Friday. And don't forget, you can always email us at medicalnewsnetwork@kumc.edu or reach out to us on Facebook, Twitter, and YouTube. We will be back to our live shows 5 days a week starting September 6th. So please go out, make it a great day.